Hello and welcome. Today we explore herbal and fascia hydration support for chronic low back pain and fascia stiffening. This perspective complements mechanical and injection-based treatments to enable true regeneration, not just temporary relief. Chronic low back pain often hides behind fascial dehydration, leading to stiffness and chronic spasm, which can result in nerve compression. Discs lose their microcavitation capacity, ligaments overstretch, and facet joints become overloaded with micro movements that further degrade stability. Micro tears may accumulate calcium deposits, making tissues rigid and non-adaptive. Persistent tension along the two meridian's paravertebral muscles sustains this dysfunction. In this sense, the two meridian itself consists of the spine and paravertebral muscles together. To better understand this step, we need to look at acupuncture growth control theory. In embryology, there is a structure called neural crest, which provides stem cell clusters for organ development. These stem cells migrate forward to populate the chest and abdomen. As they move, they pull their connection with their origin in the connective tissue layer along with them. You can think of this as a bidirectional biological light internet cable. This connection sends information to the developing organs in the abdomen and later in life continues to relay information back to the crest if an organ starts to deteriorate. When the body detects an error message from an organ, it can trigger muscle spasm in the back muscles along the spine as a warning and protective response. For example, bladder 23, the kidney shoe point, is deeply linked to adrenal fatigue because the kidneys and adrenals develop from the same embryological origin. And this weakens lumbar support. Bladder 24 and 25 reflect pelvic visceral patterns, like constipation, fibroids, or prostate issues, back into the paravertebral fascia, creating chronic tension. This creates a feedback loop where visceral dysfunction, adrenal fatigue, and facial tension generate segmental instability and microherniation potential. We don't view this as merely a mechanical issue. Instead, we see it as a reversible field matrix phenomenon that can be addressed with fascia hydration, herbal support, and energetic field interventions to restore both structure and function. Conventional treatments like injections reduce inflammation but don't address ligament microdamage. The conventional treatment is to inject a combination of local anesthetics and long-acting steroids, the former to block inflammation and pain sensation, while the latter is to support mitochondria. This is usually not enough. We will talk about the reason later. Pain medications suppress feedback but don't restore fascia hydration. Surgeries often ignore underlying blood stasis, fascia dryness, and tissue microstructure depletion. Only fascia hydration by herbal treatment and field reprogramming with manual therapies can fully reverse these chronic patterns rather than temporarily suppress them. Resolving blood stasis is key. Salvia, noto ginseng and ligusticum support microcirculation and prevent microthrombus formation. Tifa pollen, cardamus and lycopodium help clear stasis around microtears. Gua sha and cupping synergize with these herbs by clearing local stasis and microcalcifications, aiding true soft tissue recovery. Chronic low back pain often coexists with local tissue and water deficiency. Disc dehydration and fascia dryness create a state where tissues are stiff yet weak. Herbs like Ophiopogones, asparagus, rehmannia, and schizandra help structure and replenish water in tissues. Combining these with salt baths and hydration helps fascia regain elasticity and fluidity. Chronic microinflammation blocks autophagy, hindering microdamage repair. Salvia and ligusticum improve microcirculation and oxygenation, while ginseng and pseudostellaria support mitochondrial function and restore local field coherence, facilitating true regeneration where mechanical therapy alone is insufficient. Fascia hydration and structured water influence electrical and piezoelectric conductivity in the body. Herbal support alongside structured water intake can reverse stiffness. We see fascia as a dynamic water matrix that transmits energy and information, not as a passive tissue. Without water, even the best manual therapies fail. In practice, we may use a facet or nerve root injection temporarily for immediate pain relief if needed, while simultaneously starting an herbal protocol. Blood stasis resolution with salvia, noto ginseng and ligusticum, yin tissue and water building with Ophiopogones, asparagus and schizandra, adrenal support with astragalus, ginseng, dipsacus and eucomnia, gua sha or cupping for stasis and calcium clearing, and hydration and mineral support to build structured water in the fascia. We see chronic low back pain not merely as a mechanical disorder, but as a fascia water-filled disturbance. A local blood stasis issue, a yin tissue water depletion with adrenal fatigue, a mitochondrial energy deficit, and a microcalcification blockade, all of which are reversible through herbs, hydration, and structured field interventions, not just suppressible with temporary measures. We have demonstrated how alternative and integrative medicine views chronic low back pain within the fascia neural matrix. By combining temporary nerve injections with herbal formulas that restore fascia scanning and sensing abilities, we may avoid the functional losses often incurred from permanent nerve damages and permanent nerve blocks. This approach offers a pathway to sustainable pain relief, maintaining movement and preserving quality of life while respecting the body's natural healing mechanisms.